psoriasis. We'll deal with the risk factors, types and symptoms of psoriasis. First, we'll deal with risk factors. The risk factors includes family history, stress and smoking. First, family history. The conditions run in families. Having one parent with psoriasis increase your risk of getting the disease, and having two parents with psoriasis increases your risk even more. Next is stress. Because stress can impact your immune system, high stress levels may increase your risk of psoriasis. Smoking. Smoking tobacco not only increases your risk of psoriasis but also may increase the severity of the disease. Smoking may also play a role in the initial development of the disease. Symptoms. Psoriasis signs and symptoms can vary from person to person. Common signs and symptoms include red patches of the skin covered with thick silvery scales, small scaling spots commonly seen in children, dry cracked skin that may bleed or itch, itching, burning or soreness, thickened pitted or ridged nails, swollen and stiff joints. Psoriasis patches can range from a few spots of dandruff-like scaling to major eruptions that cover large areas. The most commonly affected areas are lower back, elbow, knees, legs, soles of the feet, scalp, face and palms. Most types of psoriasis go through cycles, flaring for a few weeks or months, then subsiding for a time and even going into remission. Then we'll deal with the types of psoriasis. Psoriasis vulgaris, plague psoriasis, the most common type of psoriasis, affects between 58% and 97% of the patients. Inflammatory red, sharply demarcated, raised, dried, differently colored plaques, differently sized plaques, usually covered by silvery or white scales. Involves the scalp and the areas behind the ear, the extensor surfaces of the forearms and shins, especially elbows and knees, trunk, face, palms, soles and nails. Intertriginous psoriasis, psoriasis in folds in genital areas or inverse psoriasis, affects between 12% and 26% of all cases of psoriasis. Deep red or white, flat, sharply demarcated, wet patches or plaques, scales are usually absent. Affects almost exclusively flexural body sites, axilla, antecubital fossa, inframammary creases, umbilicus, groins, genital area, gluteal cleft, popliteal fossa and other body folds. Inverse psoriasis causes smooth patches of red skin that worsen with friction and sweating. Fungal infections may trigger this type of psoriasis. Gutted psoriasis, droplet psoriasis, affects between 0.6% and 20% of individuals diagnosed with psoriasis and usually occurs in children and adolescents. Reddish drop-like papules and plaques, mainly involving the trunk, arms and legs. Onset is associated with streptococcal infections of the upper respiratory tract and prior skin symptoms. Pustular psoriasis affects between 1.1% and 12% of all cases of psoriasis. Collapsing pustules filled with non-infectious pus, involves either small areas such as palms of the hands, fingertips, nails and soles of the feet or the entire body surface, can occur as a single episode after a trigger. Next is erythrodermic psoriasis, affects between 0.4% and 7% of all cases of psoriasis. Fiery red and exfoliation of most of the body surface. The most serious type of psoriasis, potentially life-threatening because it can lead to hypothermia, hypoalbuminemia and high output cardiac failure. Nail psoriasis ranges between 4.2% and 69% of all patients suffering from psoriasis. Nail psoriasis may occur with the involvement of skin or it may occur alone, being the only symptom of psoriasis. Nail psoriasis is not only the problem of an aesthetic nature but can also restrict manual dexterity. The nail disease may be acute or chronic with varied severity. There may be involvement of only a single nail or of all nails associated with severe nail destruction or loss. Nail psoriasis may be predisposing factor for fungal and bacterial infections, which occur in 4.6% to 30% of cases of nail psoriasis. Psoriatic arthritis. In addition to the skin, the psoriasis can associate with an inflammatory arthritis known as psoriatic arthritis, which involves the joints and spines and other joints. This occurs without presence of specific antibodies in the blood. Seronegative spondyarthropathy, the rheumatic factor antibody occurring in rheumatic arthritis is also negative. The clinical symptoms are variable. However, peripheral arthritis, spondylitis, enthesitis, inflammation of the sites where tendons insert into the bone, arthritis in the fingers and dactylitis, profuse swelling of the fingers or toes are considered to be most common. Psoriatic arthritis can lead to chronic pain and change in physical appearance. Patients suffering from psoriatic arthritis have reduced physical fitness compared to psoriatic patients without it. We'll continue with psoriasis in the upcoming videos. Thank you.